So what do we see most at Trailhead Family Chiropractic? I would say the type of patient that we see most is the kid that's struggling with ear infections. And that's probably because that's how my family got into chiropractic care when I was little. My sister had chronic ear infections, asthma, allergies, had done the antibiotics over and over again, and we were in the pediatrician's office for a consultation for tubes, the tube surgery in the ears. And lady looked over and she said, "Hey, have you ever tried chiropractic?" And so since that day, my sister was 5 years old, I think, we've been undergoing chiropractic care pretty regularly. And since that day, she never had an ear infection. Her asthma went down, her allergies went down, and she lived a life that she probably wouldn't have been able to live had she been constantly under the influence of medications such as inhalers and steroids and antibiotics. And I've had so many stories like that in the office, so it's so cool to give back to the experience that we had when we were a family. One particular little kid, she had tubes twice already. She was younger, 3 years old, had almost a solid year of antibiotics over and over and over again, and she finally was like my mom and just said, "I'm done with that. I can't do this route anymore. Obviously it's not working, or else I would have stopped." And so she did some research and came upon an article that we wrote about chiropractic's effect on optimal health in the immune system and its relation to ear infections in kids. She read it, called, decided to come in, and we explained to her when we did her child scans, if there's inflammation to the upper cervical spine right here, and there's muscle spasming, that's going to affect the drainage capacity of the middle ear. And there's muscles that are opening and closing. And if there's stress in the neck, those opening and closings aren't going to happen. And so we found that stress exactly what we were looking for in the upper neck. And we did that child's first adjustment, which is very gentle. They hardly notice anything's happening. They sometimes work themselves up a little bit more, but most of the time, after it's over, they're like, "Oh, that's it." And the ear drained, and the child slept through the night. And that child hasn't had an ear infection since. From over a year of ear infection after ear infection, intervention after intervention. And just one adjustment was needed to initiate that body's healing potential. Now they still come in recognizing that if this stress comes back and builds back up, she most likely will go back into that state of chronic stress and express symptoms. Maybe it won't be ear infections, but maybe it's tummy troubles, or maybe it's neck pain, or maybe it's headaches. And this is the role of chiropractic. Not only is it amazing for helping your body get over chronic health issues, but it's even better at preventing those issues from coming back when you live that proactive lifestyle. In conjunction with exercising regularly, eating healthy, positive mental habits, taking care of yourself is super important. And in my opinion, chiropractic care is the #1 thing that we can do to take care of our bodies and keep it adapting to the outside stresses that are ever flowing.